Okay, I'm trying to get this. Sorry about that. I'm trying to make it so that the light hits my head, my bald head at the exact right angle. No, I'm joking. Um, so I was talking with a parent yesterday about their child, and this is a great question. They said, "Well, how would you, check my kid? How would you test my kid? I see kids in here getting adjusted. I see babies getting adjusted. You took X-rays on me. You're going to take an X-ray on my child." And the answer for that is, first of all, when a parent brings a baby in or a toddler or a child that can't stand on their own, we do a thermal scan. That's a non-invasive thermal scan. I had mentioned that in another video. It's the inside subluxation station. I've had that for a really long time, and we do the thermal scan. It picks up stress on the child's nervous system. Okay, so we do that test. But as soon as they can stand on their own, we take the pictures. We take the digital X-rays because we want to see if they have a curve in their neck. Which, I'll be honest, most kids do not, because they're texting. They're sitting in school all day. If they've had any trauma, they play sports. That's one thing. So front to back spine should be straight, but from the side we want curves. Okay, very important. Most children, most people in general, never heard this information, never heard that they should have a curve in their neck. We call it the arc of life. It's a cervical neck, cervical curve, but you need a curve from the side. So we check for that. And then also we do a straight A to P because we want to see if the spine is straight. And especially something to note is that a lot of times we'll see scoliosis, we'll see that, the abnormal curve, scoliosis, and they'll always say, why didn't anyone tell me about this? It's because they never checked. The gold standard to check for scoliosis is an X-ray. That's the gold standard. So I'm not going to guess. I do this every day. All I do is work on spine every single day. But I'm not going to guess. I can see if the shoulders are off, if there's a tilt, if there's a forward head posture, if the pelvis is rotated, if the spine's locked up, if the joints are stuck. We check that all the time on people on the table or when they're standing. But when it comes time to like tell a parent, oh, does my kid have scoliosis? I said, well, we got to test. I can't guess, right? So that's something you should consider, just getting checked. Like, have you ever considered getting your child's spine checked? Have you ever considered getting a thermal scan? And, most people, they're just so busy with kids. They're all over the place. Again, school's starting, they're in sports, they're running here, they're on vacation. Just, trying to take care of them on a day-to-day basis is one thing. And then if they're dealing with the health challenge, that's a whole nother situation, especially if you have more than one kid and one kid's getting sick all the time, getting a lot of that attention, right? Going to different doctors. I've been taking care of, babies and kids for a really long time, since 2001. So, I know what it's like when a parent brings their kid in here. It's time out of their schedule. But what we tell them is, look, consider getting your kid checked. So if they bring a kid in or a child or a baby that has symptoms, they bring them in for the symptoms. Obviously, we want to get rid of those symptoms. But then I'll say to them, these situations, these problems can run in families. They can run in families. And it's a lot of times we'll check a mom and she'll be like, oh my goodness, look at my spine. It's crooked. I didn't know. And about 75% of the adults that we checked, that we showed them they have scoliosis, they had no clue because they never really had this checked either. Even if they've been to a doctor to take care of their back, or they had back pain or neck pain, or they went to the hospital, urgent care, they just either forgot or it wasn't checked. It wasn't tested. I'm not saying anything positive or negative. I'm just saying they just never had it checked. But what I'll say to them is, look, these things run in families. You should get your kids checked. There are so many cases that we have where it's like a parent and a child, and you look at their spine together, and it's like the curve in the spine, that scoliosis, it's almost the same. Or obviously if the parent, it may be worse because it's more developed, that curve took off, but you can see the child, it's starting to happen, and the parent's just shocked. So I would say, something to consider making time for is getting your kid checked. And then, so once we check them, we can show you in black and white, because a lot of people ask this, how could you tell? What would you do? Is it invasive? It's non-invasive. It's a quick test. We only do the pictures that we need and that are necessary. We stand your child up against gravity, so their spine is loaded, and then we'll check for the curve in the neck. and then we'll do an A to P to check to see if the spine is straight or if they have scoliosis. We'll look for pelvic unleveling also. We can also see rotation. If it's a kid that's older, they're playing sports, we'll do a motion study on them, especially if they're coming in with symptoms. All right, so that's to answer that question. Does my kid have scoliosis? How would you check my baby? How would you check my toddler? So again, the two tests that we use, the objective testing that we use, we do a thermal scan, and then we do digital x-rays. We will also do a hands-on check. It's called palpation, where we're feeling the joints in the spine to see if they're locked up, they're stuck, if there's tenderness in the area, if there's spasm around it. That's the hands-on check, all right? And then also for older kids that, can follow these type of directions, we'll check their active range of motion, all right? So that's how we check and test, all right? So I wanted to answer that, all right? Have a great day.